get fulfillment that we have come into your presence. We thank you in Jesus' mighty name. Amen. Please, let's be seated. And I want to take this opportunity to welcome you specially to Gomwa Yesukrum. That is another name for Pentecost Convention Center. And as the director of this conference center, on behalf of the management, I want to welcome you and we want to assure you that our able staff, we are on standby to assist you that you have a successful conference. You are welcome. Thank you very much.
You can do it better for Pastor Prince Odum, ushering us into the presence of God and committing the program into the hands of the Almighty God. At this juncture, for every beautiful program, we must have someone to chair the program. And combing through the land from the north to the east, to the west, to the south, through the central region to Ashanti region, we found one beautiful person to chair today's event. And to do us the honors by introducing her is Ms. Akusia Sewa Jenin, Program Manager, Nursing, Office of the Director of Nursing and Midwifery. Let's receive her as she introduces the chairperson. Oh, you can do it better for her.
Good morning, everyone. Distinguished guests, invited dignitaries, colleagues, senior nursing managers, and our friends from the media, ladies and gentlemen, it is a pleasure to welcome you all to the maiden edition of the Senior Nursing and Midwifery Managers Conference. As we celebrate excellence in nursing, honor, dedication to service, and reaffirm our commitment to quality healthcare delivery. Nursing, as we all know, is more than a profession. It is a calling rooted in passion, sacrifice, and a firm duty to humanity. Today's program reflects our shared mission to uplift the profession, empower our caregivers, and inspire the next generation of healthcare leaders. To guide us through this remarkable occasion, we are privileged to have an accomplished and visionary leader as our chairperson, a personality whose contribution and commitment to health and nation building speaks for itself. Ladies and gentlemen, it is my honor to humbly invite our chairperson for today, Professor Lydia Asiato. Please wait, I am not done, please, wait. Prof, please, I can't call Prof just raw like that. Let me give her the accolades because she deserves it. Yes, Prof, please. So, as we all know, Professor is popularly called Prof 1 in the nursing and midwifery fraternity. She is actually the first nurse to be appointed as a professor in Ghana. Prof said I should stop, but should I continue? Thank you very much. And the first nurse to be appointed as the VC in Ghana and West Africa. Easy. And she's actually the second VC in the whole of Africa. She's really a trailblazer and an inspiration to all of us. Her appointment as a VC of the University of Health and Allied Sciences has added the university to the list of those with female VCs, the fifth in Ghana. She's still pleading that I should stop. I should continue. Thank you very much. We all know how Prof started her journey. She attended the Ghana Senior High School in Koforidua and graduated as a professional nurse in 1997 from the best NTC in the country, Kolebu Nursing and Midwifery. Prof obtained her first degree in nursing and psychology in 2001 and Master of Philosophy in Nursing in 2005, both from the best university in Ghana. That's the University of Ghana. She graduated with the highest CGPA of her class in the year 2001 and actually won a scholarship from Unilever Ghana for her MPhil program. In fact, please, I can continue over and over and over. Please, with a resounding round of applause. And the best of shouts, let's welcome our one and only Prof. 1.
Chosen generation, all for to show all I require for life, God has given me. I know who I am. We are a chosen generation. Chosen generation. All for to show all I require for life, God has given me.
Thank you very much, Akosia. My father and predecessor, the Foundation Vice Chancellor for the University of Health and Life Sciences, and also the board chair for the Ghana Health Service. Prof, I salute Prof. Inka. Distinguished members of the high table, I'm sure that you'll be acknowledged in due course. I miss all of you. For those I haven't seen in ages, Irene and your team, you know that I've missed you. I've missed most of you that I've not seen in ages. I'm very grateful to the director and her team for inviting me to chair this maiden edition of the conference for senior nurses and midwives for the Ghana Health Service, which happens to be the largest service provider in terms of healthcare in Ghana. The theme for the event, I know that there's a guest speaker who will speak to it, but I want to share a few thoughts before I take my seat. The key was in the theme, re-strategizing service delivery. It means that we have done something and we have seen the gaps thereof. And we think that we need to rethink, reflect, and see how best we can overcome some of the gaps or weaknesses. We see in the team primary health care, and we see in the team achieving universal health coverage. Because we form the majority of the health service, it is us, nurses and midwives, who can help the states, Ghana, achieve effective primary health care as well as the universal health coverage. Now, when I was thinking through when Director Eva asked me, I said Eva because we were mates at the undergrad. She became my student in the master's and PhD program, and she just passed her PhD thesis. Congratulations, Director. And the next graduation, she'll graduate, so we can confidently call her Dr. Mrs. Eva Benson. So we all know, we all here in this room, once we call ourselves nurse managers, midwife managers. You know, I'm hesitant to repeat nurse midwife. When I say a nurse, it is all of us, okay? So that the difference is not the difference, it's about the unity, okay? So we all understand the current challenges of the healthcare service. This conference should not be a repetition of the challenges, but solutions to the challenges. We all know the effort that we have made, the successes that we have chalked. We all know. But is this enough? The answer is no. So how do we continue to make impact? How can we continue to make a difference? The issues that I anticipate an in-depth discussion at this conference would be that when I was training as a nurse, 1997, I finished, the class size was such that every single student was able to have a hands-on practice in the skills lab. But these days, we have proliferation of the schools of nursing and midwifery. We have increased student numbers. Our experienced nurses are rather migrating. And so if we don't do anything about pre-service, rotation, and in-service, it will be that when it's my turn to receive care, the person who is going to care for me is not the experienced nurse. And that's, I don't want to have it, because I don't know where I'll be sick. The time I was 1997, I finished. Issues about AI, digitalization of healthcare service, electronic health records, there was nothing like that too. But now, things have changed. So I see the leaders here as my age group, so those of us before computerization or digitalization of healthcare service. And so if you are a nurse leader or a midwife leader, nurse leader, if you don't do anything different, you will be behind whilst your students are ahead. But meanwhile, the students are also not skilled. Where are we going as a health service? So I anticipate that our discussions within the next 3 days will look at technological advancement and life-threatening diseases. COVID was nowhere. COVID came. Some of us, unfortunately, lost our lives. If there's another COVID today, are we ready for it? How can the nurse and midwifery fraternity strategize, re-strategize? So I really like the keyword re-strategize. We are already doing a strategy, yes. But how do we re-strategize as a fraternity to be ready for another pandemic? Another one is that I'm anticipating that after this conference, some of us, I know it will not be all of us, but some of us would drive nurse or midwife-led interventions. Now, the primary health care, universal health coverage, if we leave it for the system, for the government, for everything to be centralized, it won't work. So it is time we rise up as a fraternity to see what interventions can we undertake for the communities that we serve, for the people that we serve, based on your interests and your expertise. Okay? You know, our children now are becoming screen addicted. Now, mostly it's not drug anymore. It's this gadgets before us. How can we intervene as nurses and midwives? The elderly, who takes care of them? The people who are differently abled, how do we care for them in the healthcare service? So we as nurses and midwives should drive an agenda based on our interests and skills to do a nurse or a midwife-led intervention. I also want us to drive the agenda of quality, customer-friendly, and timely care. I put the three together. Sometimes I'm providing quality care, but it is late. The attitude thereof is not good. So I want us to combine the three. It is quality, it is timely, and it is satisfactory to the client. These three, if we leave one out, it won't work. The last one I have here is the fact that we want to create a Ghana Health Service brand. You know, when you are going to Kolebu, Kolebu has a brand. UGMC, they have a brand. But the Ghana Health Service, unfortunately, doesn't have one or two hospitals. It has from regional, district, sub-district, chiefs. Everything is Ghana Health Service. But we cannot say because it is that broad, we should leave it. No. How do we, as nurses and midwives, within the Ghana Health Service, create a brand that makes our facilities a to-go hospital, a to-go healthcare facility, than a private or another? I know CHAC is here, I know police is here, I know the military is here, but I'm talking about the Ghana Health Service. How do I decide to go there rather than go to the 37 military hospital? So I want this conference to, prepare us such that when we go back, we could, provide a service at our various facilities to make the facility a to-go hospital. I envisioned that your participation in this conference will ginger you up, will transform you, will make you very, very committed to a healthcare service that I and you will want to go to when we are sick. On this note, I humbly accept to chair this opening ceremony. Thank you very much.
Can we do it better for Prof? Prof 1. Thank you so much. Thank you, Prof. If I took something for Prof's speech, she said she hopes by the end of this conference, if not if you were born in those days, when nurses were using syringes, reboiling and things, would you have chosen to be a nurse?
The way you started the question, syringes, boiling, I've never seen some before, so I'll not even commit myself.
You've never seen some before. So that means that people stood in the gap. Our leaders, our managers fought, and that is why we are here. So I am very happy to announce to you that when you go outside, at the back, you will see a photo shoot booth or a drop bag banner. Who noticed what is on it? Who noticed? Our past who? All the past directors of nursing and midwifery, from time immemorial till date. Who was the last one? Who was the last director before this current one? Director Shreme, thank you very much. So as we are here today, in 10 years, 20 years to come, how will those in power describe us? You are here as a leader, as a manager. It says a lot. What are we leaving behind? Put your hands together for yourself if you are a manager. All right, so it's time for us to acknowledge our dignitaries in our midst, and my brother Solo will do that for us. Thank you.
Thank you very much. And so we have in our presence Professor Jerry Paul Ninoni, Dean, School of Nursing,
Cape Coast University.
Let's give it up to him.
Please put your hands together for him.
We also have Dr. Abeta Bri Chum Nyako, Regional Director of Health Services,
Central Region.
We have Dr. Catherine Atto, National Officer in charge of reproductive, maternal, newborn, and child health, adolescent health, WHO. Let's give it up to her.
For her.
We have Madam Efua Agri, Chief of Party, IHP.
IHP. Thank you so much for coming, Madam.
We have Dr. Wilfred Ochan, UNFPA Rep. Let's give it up to you.
Rep. Dr. Ochan. Thank you for coming.
Our director, Mrs. Eva Mensah. Let's give it up to her. She is the host of our event, the Visinia. And we have our very own chair, Professor Fred Binka, Council Chair. Let's give it up to our father,
the Ghana Health Service Council Chair, standing in for the Director General of the Ghana Health Service and the Deputy Director General of the Ghana Health Service. So if we don't know our organogram, the whole Ghana Health Service, our father, our chair, please put your hands together for him. Thank you for coming, sir.
We also have in present here our retired Chief Nursing and Midwifery Officer.
Let's acknowledge them.
Retired Chief Nursing and Midwifery Officers, please can you be on your feet?
Please
let's appreciate them.
So for our retired Chief Nursing and Midwifery Officers, we have for formerly Ahafo Region, formerly Western Region, formerly Upper West Region, and formerly Upper East Region. Let's put your hands together for them.
We also have Naval Captain Ruby Amegavli, Chief Nursing Officer, Ghana Armed Forces.
Ghana Armed Forces.
Kumasi Military. Ma'am, you are welcome.
You're welcome.
We also have representative from the Ghana Police Service. Please, let's acknowledge them with a clap. And we have Mr. Samuel Akologo Esquire, First Vice GRNMA, is also here.
GRNMA.
We have Dr. Gloria Anson, Rector, Ghana College of Nursing and Midwifery. Rector, you are welcome.
You're welcome, madam.
We also have Mrs. Judith Esiama, Director of Nursing, UGMC. Let's give it up to her.
The only quaternary hospital in Ghana.
The only quaternary hospital.
Put your hands together for her.
We also have Madam Roberta Asiedu,
Head of Nursing, Catholic Health Service Trust. Madam Asiedu, you are welcome.
We'd like to acknowledge you region by region. And when we mention your region, the loudest one will get a reward from chair. I will not commit myself because when they were doing the boiling of the syringe, I was not there. So those who witnessed it will reward you. So do we have reps from Upper East Region?
Upper East Region.
Oh, Upper East, let's give it up to them.
Let's see your hands.
Upper West Region.
Upper West.
Northern Region. Northern Region. Savannah Region. Great. Northeastern Region.
Northeast. Northeast.
Ahafo Region.
Ahafo.
Oh, let's give it up to them. Bono Region.
Bono.
Wow. Bono East.
Bono East.
Ashanti Region. Oh, we'll take that again. We'll take that again. Ashanti Region. Eastern Region. Oti Region. Oti Region. Volta Region. We have Western North Region.
Western North.
Western Region. Greater Accra Region. Greater Accra Region. And now, the host region, Central Region.
Okay, so every region in the house is led by the regional chief nursing and midwifery officers. Please, let's see our CNOs. All the CNOs. Please, let's see you.
Kindly be on your feet.
All the
Let's give it up to them. Let's appreciate them with a clap. If you are proud of your CNMO, give it up to her. And give it up to him. Thank you very much.
And tomorrow, Ebejo, Sekutu, and Odieribia. Then tomorrow be the cultural day. I don't know what will happen in this hall.
Please, if I don't do this thing, I'm not sure I'll go back to Greater Accra. I heard Sekutu, and they are saying Obake, whether you like it, Obake.
Thank you very, very much. So from the northern part of the country, we will say Amaraba. Then from somewhere the Savannah region, we will say Ansansa. From the central western, we will say Yamawana Kwaba. Then the Akan regions, Yamawana Kwaba. Then from the Greater Accra areas, we will say Obake. Then from the Volta side, we will say Wezolo. And then if you want to go international, what will we say? Bienvenue, welcome. Thank you so much. So, we move on. We are going to take a few messages from our health partners. Ghana cannot function alone when it comes to health service delivery. And so we are privileged to have our health partners in our midst. First on the list would be WHO. Please let's put our hands together for Dr. Karen.
Hello, good morning. Madam Chairperson, representative of the Director General of the Ghana Health Service and other agencies of the Ministry of Health, Director of Nursing and Midwifery, representatives of our partner agencies, members of the Nursing and Midwifery Fraternity, distinguished ladies and gentlemen, all protocol observed, good morning. It is a great honor to be here today. I bring you greetings from the country representative, Dr. Fiona Braka, who unfortunately couldn't be here with us today. The theme for this year's conference, Re-strategizing Nursing and Midwifery Service Delivery in Primary Health Care towards Achieving Universal Health Coverage, the role of nursing and midwifery leaders, speaks to our collective mission to ensure that every Ghanaian, regardless of geography or economic status, has access to quality, equitable, and people-centered health care. The role of nurses and midwives in delivering primary health care, promoting health, preventing disease, and providing compassionate care cannot be overstated. However, with the evolving health landscape marked by geographical shifts, emerging diseases, and increasing patient expectations, demands that we rethink how we deliver care. It calls for transformation in leadership, innovation in practice, and a renewed commitment to excellence. As leaders and managers in nursing and midwifery, you are uniquely positioned to drive this transformation. Your leadership is critical in shaping policies, mentoring the next generation, and ensuring that your services are aligned with both national and global health targets, including the SDGs and the pursuit of universal health coverage. The WHO Pathways for Leadership in Health Transformation Program has been a great capacity platform for senior nurses and midwives, producing agile leaders from whom reflective, appreciative, and ethical leadership constitutes the new way of work. Nurses and midwives are central to the implementation of Ghana's free primary healthcare initiative. Through community outreach, health education, and the delivery of essential services, you serve as the backbone of primary health care, especially in our rural and peri-urban communities. You have a critical role to play in reversing the persistently high maternal mortality rates in Ghana by championing quality maternal health services, advocating for policy reforms, and strengthening midwifery education and supervision. WHO, through its Global Strategic Direction for Nurses and Midwives 2021 to 2025, outlines 4 key policy areas that are essential for enabling nurses and midwives to contribute to universal health coverage, including education, job creation and management of workforce migration, leadership, and service delivery. These recommendations align seamlessly with Ghana's nursing and midwifery strategy of 2024 to 2028. The WHO Country Office has worked closely with the Ministry of Health and its implementation agencies in ensuring that Ghana's nursing and midwifery standards can be compared globally across the world. This conference offers us an opportunity to reflect, to learn from one another, and to forge a shared vision for the future of nursing and midwifery in Ghana. In closing, I urge all of us to lead with courage, compassion, and conviction. The path to universal health coverage is not without challenges, but your leadership, your innovation, and your unwavering dedication is key to contributing your quota to achieving universal health coverage in Ghana. WHO remains committed to continuing its collaboration with the Ministry of Health, the Ghana Health Service, and the leadership of nurses and midwifery in Ghana to ensure the attainment of universal health coverage. Thank you once again for your invitation, and I wish you all a fruitful conference.
Thank you very much, Madam, for that speech. Yes, we now sign apologies. We will take the welcome address from the Regional Director of Health Services, Central Region, Dr. Albert Abrichu Nyako. Please put your hands together for her. Thank you. Please, let's continue putting our hands together.
Thank you very much. Our chairperson, Professor Lydia Aziato, Vice Chancellor of UHAS, the representative of the Director General of the Ghana Health Service and the Chairman of the Ghana Health Service Council, Professor Fred Newton Binka, the Director of Nursing and Midwifery Service, Ghana Health Service, Dr. Wilfred Okan, Country Representative for UNFPA, the representative of the WHO Country Rep, our guest speaker, Professor Jerry Paul Ninoni, esteemed past and present directors and managers of the nurses and midwives in Ghana, representatives of agencies and identifiable bodies and groups here present, esteemed nurses and midwives, leaders and partners in health, ladies and gentlemen, members from the media fraternity, good morning. It is an immense pleasure to stand before you, the backbone of our health system, that is, our nurses and midwives, at this critical conference. The theme, Re-strategizing Nursing and Midwifery Service Delivery in Primary Health Care towards achieving universal health coverage, the role of nursing and midwifery leaders, is not just relevant, it is the blueprint for our collective future. Universal health coverage is our overarching goal, a world where everyone, everywhere, can access quality health care without financial hardship. At the heart of universal health coverage lies primary health care. It is the first point of contact, the most comprehensive and the most equitable level of care. And who is the most frequent, trusted, and often face seen in primary health care, especially in underserved communities and areas? It is you. You, our nurses, our midwives. Nurses and midwives form the largest part of our health workforce. Your roles, from health promotion and disease prevention to maternal, newborn, and child health services, are the essential ingredients for a strong primary health care system. Yeah, I think you should clap for yourselves. However, we must acknowledge that what got us here in 2025 is not what will get us there in 2030. We must re-strategize. And re-strategizing means moving beyond traditional roles and embracing a new paradigm of service delivery. This involves 3 critical areas. The first one is optimizing the scope of practice. We must empower and utilize the full capacity of our nursing and midwifery professionals wherever they are. This involves task shifting and task sharing where appropriate, particularly in areas like chronic disease management, mental health support, and advanced family planning. Nurses and midwives with enhanced training must be authorized to make decisions and lead care delivery within their competencies, relieving pressure on higher levels of the system. The second thing we must know or think about when we want to re-strategize is digital transformation and data utilization. And I think this was also said by our chairperson. The future of primary health care is digital. We must integrate new technologies such as telehealth and telemedicine and digital record systems such as our e-tracker, the LIMS, which is now being replaced by the GIMS, the GILMIS, which is for logistics, our new Ghana Health Service website, and so on. We must be conversant with these apps and these software. So we can no longer say that we were born before computer or we were BBC. We really must apply ourselves when it comes to digital devices use and software. This isn't about replacing the human touch. It's about making your work more efficient, evidence-based, and impactful. As you capture quality data and you go ahead to analyze it and use that information therein, you will become vital contributors to policy and resource allocation decisions. The third thing you must consider in re-strategizing is community-centric care models. That is, care models that look at communities, not only patients in the hospital. Our services must pivot further towards the community. As nurses and midwives, we are used to our traditional working spaces, which is bound by walls and fences and facility gates. But in this dispensation of re-strategizing for primary health care towards universal health coverage, you must break down those mental walls and see beyond them. Don't only see beyond your walls, but dare to step out and make a difference in the quality of care in the district and sub-district, where most of the consequences of poor clinical care emanate from. This means collaborating with district directors of health service and strengthening outreach programs, clinical support visits, fostering deeper connections with community health volunteers, and ensuring cultural sensitivity in service delivery. Primary health care must be brought to the people. We must not just wait for the people to come to the clinic or to the hospital. So, Prof. Chair, distinguished ladies and gentlemen, after suggesting in what ways we can re-strategize, let us look at the role of the nursing and midwifery leader in this space. This ambitious transformation cannot happen without strong leadership. To the nurse and midwife leaders in this room, you hold the key. Your role is no longer confined to clinical supervision. It is about transformational leadership across 4 pillars, which are advocacy, mentorship and education, policy engagement, and resilience and wellness of our staff. I will start first with advocacy. You must be the voice for your colleagues and for the communities you serve. Advocate for better working conditions, fair compensation, continuous professional development, and the necessary resources to deliver quality care. The next pillar is mentorship and education. Invest in the next generation. Grow a younger version of you, or grow a mini you, such that somebody would say, Alberta works just like Auntie Margaret Nyako Sampson, or Alberta works just like Nurse Gladys that she learned from in Kumasi South. Grow a mini version of you